We did our project on the improvement of preeclampsia outcomes through effective management and treatment. The group members include Kaylee Harris, Becky Davis, Abby Mallman, Mariah Cornett, and Brooke O'Toole. Our PICO is, in nurses who take care of preeclampsia women, how does education on preeclampsia management and care compare with no supplemental education on preeclampsia management and care affect nurses' knowledge on the management and care of preeclampsia?
So why did we choose preeclampsia? The topic of preeclampsia struck us because it is the leading cause of maternal death and illness globally. This disease plays a role in 2 to 8% of pregnancies worldwide and 15% of premature births in the US alone. The only way to treat this disease process is by delivery of the placenta. It was staggering for us to see such a significant knowledge deficit regarding this disease process, despite the high frequency of negative consequences for patients. Our preliminary research found that there's a significant lack of education regarding the preeclampsia disease process, as well as its signs and symptoms. For instance, in one study, 56.7% of women reported receiving little to no education of preeclampsia from a healthcare professional. Another study found that 24-hour urine specimens, a diagnostic tool for preeclampsia, were collected wrong up to 73% of the time. Both this lack of knowledge and education could be found in obstetric nurses as well as their patients and had been proven to negatively affect patient care outcomes.
So the goal of our project was to determine if there was a knowledge deficit in our local hospitals, and then to implement an educational project that will further educate the obstetric nurses so they may utilize this education into clinical practice to prevent poor patient outcomes in the future. So we implemented our project through an email sent of our educational PowerPoint of preeclampsia to antepartum and labor and delivery nurses at Good Sam and UCMC. We then tested effectiveness of our PowerPoint by having the nurse take pre and post tests. The pre and post tests contained 5 of the same questions given before and after the presentation. The presentation was about 7 minutes long, and the topics included on the presentation were treatment, care, management, and education of preeclampsia.
For our outcome, we looked at comparing the data between our pre and our post assessments that were in our PowerPoint. There was an increase in knowledge after reviewing our educational presentation, which you can see in this bar graph here. We have the pre-test in pink and the post-test in blue. And with this data, you can see that the lack of knowledge shown in the results from the pretest is quite surprising, considering these nurses work with preeclamptic patients daily. The probability that this lack of knowledge has had a negative impact on patient care is high.
In conclusion, there is a lack of knowledge about preeclampsia care and treatment in OB nurses. Consistent and regular education is effective in improving awareness about preeclampsia in the disease process. This was demonstrated by our statistics from our pre and post test. This additional knowledge has the potential to improve patient outcomes when provided to these populations. Our recommendation is consistent and regular education be provided to OB nurses regarding preeclampsia management and treatment. Thank you for watching.